Well, hello everyone, and welcome to Summit Alliance Advantage Thursday training. Today we're going to be talking about understanding underwriting, and how to really direct your clients accordingly, based on what medical challenges or needs that you run into out in the field. It kind of is a good, definitely a good thing to have, those steps in place. And with some of the markets can be a lot easier than others. But we're just going to touch on overall underwriting, working with your client, directing your client to the right products today, and that's what we're going to cover on today's call. My name is Jason Martinez, and again, you are on the Thursday Summit Alliance Advantage training webinar. We're going to go ahead and jump right into it here. Now, as I mentioned, understanding underwriting with carriers is very important. This could mean having a higher percentage of the applications that you sit down and take the time to, fill out and try to get approved for your client, getting those approved. And, if you're out in the field and, you are not very familiar on how to direct your clients, or maybe you don't ask the right questions, or maybe don't even ask and just kind of, submit the application with the product that, the client may not qualify for, or you're unfortunately that's not going to go through. So by understanding how to, direct your clients accordingly, utilize the resources, we're going to talk about all of that. And, especially understanding the difference between non-medical and fully underwritten. I'm going to talk a bit about that. I've mentioned this before, but, it's always a good idea to get the carrier underwriting guides, especially for your market of focus. If you're, really passionate about the mortgage protection market, then, you need to have the underwriting guide for the carrier that you're using and for the product that you're using, so the qualifications, the ins and the outs, and what they're looking for. Also understanding how to do a risk assessment. You may run into a case where the underwriting guide may not always give you the direction that you need to go, or there may be some other conditions in conjunction with particular conditions. So we may have to get a risk assessment done, and so knowing how to do that, and just briefly, you simply call the carrier, ask to talk to an underwriter, and the underwriter is going to ask you a few questions. They're going to ask you, of course, the client's height and the weight, their age, and then, of course, what medical challenges that they're looking at. What is the diagnosis? What type of treatment are they taking? And, is it expected to resolve, or what exactly is it? And, so they'll ask you these questions, and they'll let you know, well, the client would potentially qualify for this, or the client would possibly be rated at this based on these medical conditions. And, so understanding how to do and just knowing how to do a risk assessment and utilizing that resource is very important in itself, because that's going to help you gain just that additional knowledge on how underwriters think, because they're talking to you, they're telling you why they need this information, and, you're understanding what they're looking for. So, next time you run into that, you already know, what the carrier is looking for, and you may not have to do a risk assessment. You may already know which direction to take your client. And so, just understanding that's very important. So, keep that in mind. You simply to do a risk assessment, you call up to the carrier, ask to talk to the underwriter, and then, follow through with the client's information. Now, what's great, you don't have to give client name or social or any personal information, just medical information and the parameters of that, so they can, determine what that particular case would qualify for and how that would be rated, based on their underwriting. And, understanding how to do a risk assessment, that's going to help you direct your clients accordingly. If you know that your client will still qualify for this product, but yet there's a few things that they have to do extra, or additional information that's going to have to be obtained, or with the rating or something to that effect, at least you know where to direct your clients, and you're not going to direct them to something that they're going to get that decline letter. Because it's a lot easier to kind of prep your client before they get a decline letter. Look, what we're doing here, we're going to take the, a shot at the best option first. And, based on the medical challenges and based on my information from the underwriter, this is, the direction that we're going to take you. And, by doing that, taking that extra step, again, you're going to increase the chances of you getting that approval for your client. And not only that, you're preventing yourself from being in a situation where your client gets the decline letter. Then you have to go back out to the client and, we can always try this, or we can try something else, as opposed to they know that, okay, I may get this, but my agent can direct me, to the next best product. And when I'm working with my clients, that's exactly what I tell them. We'll be able to apply for this coverage, and if for some reason it's not accepted, we're still taking a shot at it. It may not, and then we can apply for the next best product. And so if I'm in a fully underwritten situation, or if I'm in a situation where their medical challenges are extreme or at question, then I'm going to prepare. I'm going to let them know, look, I'm going to bat for you. We're going to find the product that's best going to meet, the medical needs that we have here and the medical challenges we're facing, and make sure, that we put you in the best, the best product. And, because no one wants to pay any more for their coverage than they have to. And if we can get you, the best rate out there, that's absolutely what we're going to do. That's what we're going to fight for. And, so just bear with me, and, we're going to make sure and get you taken care of. And, and I work in that manner, and I do the arm wrestling for my clients. I contact the underwriters. I make sure I'm directing them to the right product, and go from there. Now, as I contact the underwriters, or as I identify, the medical challenge, whatever it be, let's say it's high blood pressure. If it's a non-medical product, you need to utilize your supplemental forms. Supplemental forms for medical conditions, really, you need to utilize them for both non-medical and fully underwritten. But basically what this allows you to do is gather more information that pertains to that condition. For instance, if it's high blood pressure, they're going to want to know the high blood pressure reading. They're going to want to know some other bits of information, the medication taken to control, how long they've been on that medication, things to that effect, because that's going to let them know, okay, they've been on this medication for over a year. It looks like it's under control. If medication, we've had 3 different medications over the past year, well, it may not be under control. They're trying to figure out what's going to work best. So they may rate that client until it's under control. So again, these supplemental forms are going to give you the questions to ask the client. Because if a client is diagnosed with something, the underwriter wants to know, more than just the diagnosis. And, they want to know the results from that, the type of treatment, the expectations from that. And, again, that's all going to help them make a decision. Because you got to remember, what you're doing here, you're setting your client up for a policy that they may only pay $50, $60, even let's say $200 a month for, and yet the carrier, if something happens to this person, is going to have to turn around and cut their family a check for $200,000 or whatever it may be, $1 million, depending on whatever policy they got. So they're going to take these underwriting steps, and us as field underwriters, as agents, if we understand the information that they're trying to gather and answer their questions right off the bat, then they're able to make that decision right away, and it's a lot easier. It's a lot smoother process, and it works so well. Again, that's one of the things that goes hand in hand with your business, understanding how to get your business approved, and that has to do with underwriting. Now, if you need to call the carriers to follow up on pending. This is another way to kind of learn about underwriting. They may say, well, we saw this on the MIB, the Medical Information Bureau, so we need more information about this. So you may have to get a supplemental form filled out or something to that effect. And, maybe the client had diabetes in the past, and due to diet and exercise, they were able to get rid of the metformin. But yet metformin is still on their MIB. Well, no, I don't. They answer the question, no, I don't have diabetes, because in their mind, no, I don't. I got rid of it. And so their prescription shows up on the MIB. The carrier may say, hey, well, we need more information about this. With that form, you go out there, you get that information. Okay, it was diagnosed, back in 1998, but back in, 2005, due to diet and exercise, was, guidance of the doctor, no medications no longer needed, or whatever, But again, you're with the underwriter, you're giving that underwriter the information, because on the other hand, if the underwriter just sees that they're prescribed metformin, they're like, oh, wow, this person has diabetes. They didn't put it on the application. Well, what are they trying to hide? Or why? What's the results of this? Is it still under control? Are they now taking insulin? Whatever the case may be, so they're going to wonder, basically. But if we have those questions answered, they're going to be able to make a decision. I call it painting a picture for the underwriter. And, so following up is going to allow you to get your business pushed through. The fortune's in the follow-up. We all know that. And, submit new business properly. We always tell, agents, submit the applications through our office with the new business cover sheet. That way we have kind of an outline of what the product's supposed to be and do, and then we can look at that. We can cross-reference everything. We can make sure, that the premium matches the age, that the premium matches the product, that the answers to the medical questions that this client will be, more than likely get approved for this, or, that it's including all the additional forms that are needed. All of these things we can help make sure in order. That way when it gets to the carrier, it stays in what we call jet issue status, which means the underwriter receives it, they see the answers to the questions, they see the detail, and they know what's going on with this case, as opposed to them getting the application. There's lack of detail, there's lack of information, they request for that information, stick it on the bottom of the pile, and it doesn't go anywhere until that request is fulfilled. So you want your applications to stay in jet issue status, so very important there. Now, just real quick understanding non-medical versus fully underwritten. Non-medical, we all know there's no exam, there's no blood work, no urine, no physical exam. It's simply an application with some medical questions that we're going to ask the client, that they're going to check the MIB, and they're also going to check the prescriptions. So, again, as agents, we're the field underwriters. We're required to gather this information for the underwriters. That way, again, they can make a decision. I touched on that. Now, non-medical does not mean guaranteed issue. Some agents, of course, new agents in most cases, some seasoned, unfortunately, but, will think that, oh, there's no medical exam, well, they automatically qualify. And unfortunately, that's not the case. They still have to answer medical questions, and they still have to qualify medically based on those answers, based on their medical history. Now, the advantage that a non-medical policy does, of course, there's less scrutiny, and there's less, information that's needed as far as, actual blood work and stuff like that. So our job is to gather enough information for the underwriter to make a decision. Get the complete story. Not just the diagnosis, but also the results. Was it resolved? What type of treatment is needed? Is there additional treatment needed? Is there additional surgeries needed? What's the case with this medical challenge? And again, if you have all this information, the underwriter's not going to wonder about it or have to go search for it. Because just imagine this: if you submit the application and it just has the diagnosis, well, the underwriter will look at that, and they're not sure about it. They may decline it, and if they're having a good day, they may just, ask for additional information from the doctor, which is called an APS, an attending physician statement. What that means is that they didn't have enough information, so they had to go to the doctor to get that additional information, and unfortunately, that can take forever because doctors, that's not the first thing on their calendar when they walk in the office that day to tackle, and is getting medical records for a patient that they've already seen. That doesn't bring money into the office, so they're not too worried about that. So in most cases, they put that off and then they forget about it. So and then sometimes it never gets back to the carrier, and the application expires or what have you. So you can follow up with the doctor's office to help expedite that. We do that all the time. Let them know we had a client, you have a patient by the name of this, we had, they're applying for a life policy and they're trying to get approved for it, but they need more information from you. We've had the HIPAA signed, we've already sent over the request. If you don't mind, if you could have someone in your office expedite this request for us, that would be greatly appreciated. Just become nice, become friendly, talk to the person on the phone, and that can help get that additional information for your client. So if you're in that situation where there's been an APS requested for your client on the application you submitted, just know that you can contact the doctor and help expedite that. And, also, I mentioned it's the opportunity for the client to obtain coverage without the scrutiny of an exam. I've been in a situation, I was in Southeast Texas, and I had a gentleman in his 40s, totally healthy, worked outside, had a little construction company, and worked outside at home. Always, had a little bit of land, worked outside on the farm all the time, and just a healthy guy. And he was totally confident in his health, and he wanted to take an exam to save a few premium dollars each month. And although I did my best, Tom, let's put you in a position where you have the coverage in place. Let's put the safety net in place, with this non-medical policy. And then, if we want to do an exam and try and save you a few dollars, we can do that. Unfortunately, he didn't want to do that. He wanted to take the exam. I'm totally fine. Let's I go to my doctor all the time. Let's do an exam. So, okay, great. We did an exam. Come to find out, in the blood work, he found out that he had hepatitis, and no symptoms, no nothing, but he has it, a carrier, what have you. So unfortunately, at that point in time, he became uninsurable with that product. So he was limited, and that also was now on his MIB, his Medical Information Bureau. So that also limits his option. That also eliminated him from the first non-medical product that I tried to get him approved for. And so, again, you want to safeguard your clients. You want to protect your clients. And if your client can get the coverage without, having to do an exam, without having to find out something they don't know about, that's more likely an ideal situation for your client, because if you can get them covered, that's what needs to take place, not no coverage at all. And so just a brief story. I mean, I've had other unfortunate situations. I had a lady who took an exam, and she had I guess they were small veins, and they had to use the examiner did not come prepared with, I guess it was a spider or some type of special needle used to draw the blood out of small veins. And so they're trying to draw the blood out of her veins, and they're having a hard time doing it, and she's getting upset. And then they decide to check her heart rate. Gosh, go figure. So she has an elevated heart rate due to them having a hard time trying to take. So, and she's healthy as could be. So another 6 months later, after going back and forth with the carrier, after them allowing me to do another medical exam and sending out an underwriter with the, approved needle, or the specific type of needle that made it easier for them to take the blood sample or the blood work, we were able to get her approved. But again, we had to go through that, and totally healthy, had, high blood pressure on her MIB, and she really didn't, it was because of the exam. So, so much can happen with exams is my point to that. So if you can keep your client in a non-medical situation, that's always the best way to get them covered. Also, keep in mind that underwriters become familiar with the agent's underwriting habits. So in most cases, really pretty much with most of the carriers, the same underwriter is assigned to your business. So if you're sending in business, and just imagine yourself as the underwriter, you're receiving an application from Agent Joe Good Business, and Agent Joe Good Business sends in good business. And so you look at it, everything's in order, all of the questions are always answered, all of the detail is always there, all of the supplemental forms are always included for additional medical challenges, and everything is in order. Well, if for some reason something comes through one day, that agent, Joe Good Business may get the benefit of the doubt, whereas, Bill Bad Business, submits the business, and it's missing information and it's missing stuff. So this underwriter looks at, oh gosh, here's another application from Bill Bad Business. Let me stick this one on the bottom and I'll get to it later. Or gosh, oh look, already he's missing something again. Put in the, so the underwriters become familiar with the agents, and the agents that are out there, and their underwriting habits, and how they're working to gather that information. So make the underwriter your friend, make the underwriter excited when they get your business, and oh God, this is great, Joe Good Business, this no problem, let's get this approved. And just keep that in mind, because that's underwriters, again, you're going to get the same underwriter in most cases for your business with the carrier. And if you're submitting good business, they're going to recognize that, and again, they're going to understand that you have good underwriting habits, not poor underwriting habits. Now, fully underwritten, it requires blood work, right? It requires an exam, urine samples, whatever the case may be, physical exam. So, in most cases, that's up to us to schedule the exam. There's companies like Exam One, Portamedic or maybe EMSI. You can use any of these companies. A lot of them are very friendly. One thing that I've done, especially here locally, I have a local examiner, that we've, developed a great relationship with. What that allows me to do is place the order with the examiner directly. The examiner lets, I know that the person that's going out to my client's home is friendly and nice, whereas who knows who they're going to send out if you just contact Exam One, Portamedic, or EMSI, and they send out great people, but just to know that I can tell my client, we have Michelle coming out. She's great, very experienced, been doing this a long time. She's going to be the one that you expect to contact you to come out and get this exam done. She's probably going to contact you in the next 24 to 48 hours. For me, that's great. I love being able to help direct my client, but at the same time, you can let your clients know you're going to be contacted by the examiner. They're going to contact you in the next couple of days, and they're going to schedule a time to come out and do the exam. And I always tell my clients, if I'm in a situation and they have to do an exam, go ahead and kind of, if you don't mind, kind of watch your diet a little bit. Try to eat, a Mediterranean style diet. Because you don't want your client to, have a bunch of coffee before the medical exam or something like that, and again, heart rate accelerated and show up or something to that effect, or maybe they, have a fish fry and just eat a bunch of fried foods and all of a sudden their cholesterol's elevated and it normally is not, or whatever the case may be. You want them to try to fast a little bit, try to drink water, so stay away from the sodas, coffees, things like that, just to try to get an optimal result on the exam. And, just 24 hours before, not like a week of fasting or something like that, but, just try to be mindful of your diet at least 24 hours before your scheduled exam. This is going to help get optimal results. And I'll let my clients know that. And, and also know that fully underwritten is going to be a little bit more lengthy underwriting process, so I'm going to continue to follow up. I'm going to follow up with the examiner if I need to get the exam results sent directly to me because the insurance carrier can't pull them through the barcode or whatever. That's happened before. Again, that's why I like having, a great relationship with the examiner, or maybe the doctor has an APS request. Again, if an APS is ordered, follow up with the doctor that it's ordered from. But the benefit, there's a benefit to fully underwritten. It does give the client the opportunity to get a preferred rating. Again, they can save some premium dollars if the results come out, optimal and great results. And, but understanding the difference there, understanding how to direct your clients, understanding that you want to try to get your clients with a non-medical product. Gosh, we have a lot of non-medical products that are just about right in the premium range as fully underwritten products. The only way it would be less expensive for fully underwritten is if they got a preferred rating. And, most people qualify for standard anyway, so, just understand the difference there and how to direct your clients. Now, here's just an example. I always mention get the underwriting guides, get the product guides from the carrier. This is an example of some of the information that you can find on those, for blood pressure, right? If the client wants a super preferred rating, well, they need to have no history of treatment. And their blood pressure readings may not exceed 130/80. Okay, well, if they want to try and apply for preferred controlled with treatment, readings may not exceed 135/85. So again, you can see right here, what they're looking for, the height and the weight. Guidelines, the maximum that they can weigh for super, the maximum they can weigh for standard. So again, a lot of information to help direct you. So if you have a client, okay, this client is diagnosed with diabetes. Okay, well, it looks like I need to expedite the application. Let's look at that column, go down to diabetes. I need the date and age of diagnosis. I need the medications. The applicant's last A1C reading, their hemoglobin test. Again, that's an important reading, a good reading, 6.5 or less in most cases, so just knowing these things, knowing their blood sugar, it's an automatic decline if diabetes with the history of cardiovascular disease. So if someone has diabetes and has just had a heart attack, well, more than likely they're not going to qualify for like a term or a preferred or premier product. You're going to have to look at, maybe a final expense product or a whole life product or something with a little bit more loose underwriting. And again, we can guide our clients accordingly. This is just an example of what an underwriting guide looks like and how it will instruct you on how to guide your clients based on the medical challenges. You know, if you have someone with epilepsy, you know, it's an automatic decline if there's mental deterioration or personality change, if it's poorly controlled, or if they've had more than 6 seizures per year. You know, but to expedite the application, you can include the date of diagnosis, the type, grand mal, petite mal, you know, the current medications, the frequency. You know, again, you're painting a picture, you're giving detail. You don't want to say client has epilepsy. Yes. Okay, well, when was it diagnosed? You know, what type? You know, what medication? How often? You know, so again, there's additional questions, not just yes. You know, so again, it's important to understand the detail behind the underwriting. You know, and again, just some additional information here. You know, you can look through, you can look up the medical condition and see what the qualification is. Now, they're going to have this underwriting guide for the product, for the carrier. And again, if it's not answered in this underwriting guide, you can call the carrier. You can do a risk assessment. You know, you can always find out how to direct your client. One thing that I always like to bring up, for if you're covering children, you know, and this is pretty much standard across the insurance industry, all siblings should have the same total amount of coverage, right? You don't want to cover, you know, the son for $100,000 and the daughter for $50,000. They both need to have $100,000. Now, if they both have $100,000, it's limited to half of the parent's total coverage. That means the parents need to have at least $200,000. And you know, so again, you can't have a parent that only has a $50,000 life policy go out and purchase a $100,000 policy on their kid. The insurance industry, you know, they don't like that. So, you know, just understanding little things like that. You know, maybe you run into a client with a bankruptcy. Pull out your underwriting guide for that product, for that carrier. Some carriers are different. Some carriers don't even ask about it. But if this carrier asks about it, look at and see what the requests are. The request here is that it's been discharged. Okay, great, not a problem. We can still apply. You know, so again, just understanding how to direct your clients. Another way, make sure that you have the prescription indicator list. Sometimes and also make sure you give detail to the prescription. So let's say this client is taking a medication for Parkinson's disease or restless leg or something to that effect. Now, there's some medications that are taken for Parkinson's that are also taken for restless leg syndrome. Now, if you just put the medication on there and you don't indicate what it's taken for, the underwriter is going to assume the worst. So they're going to assume it's taken for Parkinson's and maybe decline it. But if you indicate what it's taken for, then they'll have an understanding. Or you may have a medication that's on the automatic decline list. You know, so again, you know, you want to look here. You want to see if that medication, you know, if it's a yes or a no. And, you know, again, the reason why they're taking it. Because if they're taking it for a reason other than the decline, you know, there's still a chance you could get that, you know, particular client approved with the understanding and the underwriter, you know, that the medication is taken not for the declined condition, you know, but for another condition, you know. And again, this is just a little bit more further into the prescription indicator list. You simply look up the medication and you're going to, you know what product to direct your client to. Now, just real quick recapping kind of what we know. You know, you understand the difference hopefully now between non-medical and fully underwritten. You know, you understand how important the carrier underwriting guides can be, you know, especially for the market that you're focused on. You know, you understand how to do a risk assessment. You know, contact the carrier underwriters. You know, ask them about your client. Give them the information and see if they can get approved for that product. They will let you know. They'll let you know, well, maybe the client's not approved for this, but, you know, maybe you should look at this product that we have. And, you know, so they may recommend another product, you know. So again, that's going to help you direct your clients accordingly. Also utilizing the supplemental forms, you know, and calling the carriers to follow up on your business. Also, use your agent mentor and your product team. You know, if you know, you're in the home with the client and you just run across this, now another thing, make sure you're prepared. This isn't a previous training, but make sure you have the supplemental forms with you. Make sure you have the additional forms. You know, me, when I go out, I always carry my little accordion style file, and it has forms from multiple carriers for multiple conditions for multiple products, because I want to make sure if the client tells me, oh, you know what, Jason? Yeah, I did call you here for final expense, but I was thinking I actually want 100,000, and I want 100,000 a permanent. Oh, well, I need to get the application for whole life. I need to look at the essential whole life with World Air or something else. Another, the provider whole life with future, whatever it may be. I need to look at another permanent whole life policy that's going to cover more than just the 35 or 50,000 that they're looking for. But I have that in my in my file ready to go. I don't have to, oh, you know what, I'll have to come back. I have that with me. Same thing if they tell me they have I'm sitting there and I'm doing a mortgage protection product. And, mortgage protection, you have to get a little bit more detail to the medical condition. So they tell me they have diabetes. Well, I have a diabetes supplemental form with me, date of diagnosis, what type of medication, what's your blood sugar, what's your A1C. So I have that form with me ready to go, ready to qualify my client. Now, in final expense, the app is the map. The answers to the medical questions are going to tell you what they qualify for. It is that easy. You really, do not have to contact the underwriter. There's really not much of an underwriting guide for final expense products. Again, because the app is the map. Based on the answers to the questions, it tells you on the application what they're going to qualify for. And, pretty much all the carrier products and applications are identical to this. Based on those answers, it's going to tell you what they qualify for. Now, with mortgage protection, you want to make sure and have your underwriting guides. You want to make sure and have your prescription guides, and be prepared to do risk assessments as needed. Again, because you're going to run into those medical challenges and you're going to need to direct those clients accordingly. Your client may not qualify for a non-medical final expense product because let's say they had a heart attack 7 years ago. They may not qualify for the non-medical, but they could still potentially qualify for the fully underwritten with a rating. Maybe 150% rating or whatever, table 2 or a table 4 rating or something like that. Again, looking at your underwriting guides and looking at the medical information on there, cardiovascular, it will tell you heart attack 5 years, within the last 5 years, automatic decline, 5 years or, over 5 years, potential rating, check with the underwriters. You call the underwriter, let them know. They may ask you a few questions. You may need to get a little bit more information like the degree of the heart attack, how much the heart was damaged, stuff like that. But again, you're going to be able to get a rating, a more accurate rating, and be able to go back to that client, not a problem, Mr. Client. I know 10 other agents have told you can't get coverage because you've had a heart attack, but guess what? I've been doing my homework. I've done my due diligence. I've checked with the underwriters, and we got an underwriter, a carrier right here, let's say Transamerica, that's going to offer you a great rating and still give you a policy in your hand. I just need to get a little bit of information from you, get the process started, and walk them right through it. And the clients appreciate that. They appreciate someone taking the initiative, arm wrestling the carrier for the client. Remember, you're the agent. If carriers, were going to cover the clients directly, they wouldn't need agents. If they were going to answer all this, if they were going to, gather all this information, they wouldn't need agents. Us as the agents, we got to gather this information. We got to direct the clients. We got to make sure that we're providing the carrier with we're the advocate for the client. We want to get the client approved. And so, having all this, doing all this extra underwriting and making sure that you're good at underwriting. Now, mind you, it sounds like a lot, but again, this is going to take you, if you have someone with some extra medical challenges, maybe an extra 10, 15, or 20 minutes to gather that information. But wouldn't you much rather spend even 30 minutes extra in the home gathering this extra information as opposed to, waiting 2 or 3 weeks to not only find out that your client was declined, or not approved for the product, again, because you didn't have enough information or because you didn't spend that extra time. So again, it's a lot easier to take that extra time and gather that information and get an approval, get your client covered to get paid, than it is to, do all that work that it takes to get in front of the client, close the client, submit the application, and then have, a not so good decision. So IUL market, again, you got to know your underwriting guides. You got to know your prescription guides. You got to do your risk assessments, and then, the proposals. And that's where your product team's going to come in. That's where we help you. We're going to, put together the proposals that you need. National Life is great at that. You know, that's one thing that I'm big on. You know, if I have a client, I'm going to get a few proposals from National Life, and I'm going to come back and try to match those proposals myself. But ultimately, you know, I'm going to let the pros do it. And, you know, I get my proposals, and you know, of course, you can run them yourself. I even do that, like I said, match them up and go from there, and you know, maybe add a few more options here and there. But for the most part, you know, again, understanding your underwriting and how to direct your clients there, and you may have to direct them to a fully underwritten product, or they may qualify for the non-medical IUL up to $1 million. You know, so again, just understanding your market, understanding underwriting as a whole, and what the underwriters are looking for, and knowing that you're the field underwriter, knowing that we're the ones that arm wrestle for our clients. You know, don't you know, think that you know, you can just submit an application for a non-medical product and you're going to get an approval right away. You know, there's a little bit behind that. You have to make sure that they qualify for the product, and just knowing your underwriting, knowing how to direct your clients, reading your underwriting guides are going to give you that information to qualify your clients accordingly. So, you know, hopefully you got a good understanding on how to direct your clients, how to utilize the products, and how to submit your business. Guys, you know, the new business cover sheet, again, just a brief overview of the product. You submit that to us here at the home office. We put that second set of eyes on it, make sure that it stays in that jet issue status. Again, that's very important. You know, being out in the field, getting paid, and getting your clients covered. And, you know, again, we're going to make sure that everything is in good order. You know, proof the field underwriting, if you will, and, you know, help expedite, you know, the processing of the application. So with that, I want to thank everyone for attending today's training. If you have any questions at all, don't hesitate to give us a call here at the home office. And I want to thank everyone again for attending. Giddy up.